Is a stroke reversible? Of course it is. Well, let's understand why Abudo thinks it is. A stroke is a medical state that is related to an obstruction in the supply of blood. When blood flow is restricted in the brain cells, they start to die, causing a specific part or various parts of the brain dead or damaged. Since the brain is the central command of the body, if a part of it is damaged or stops working, a part of the body is directly affected. This is why stroke sufferers often lose their speech, cannot move a part of the body, have a droopy face, or have a memory lapse. A stroke can vary in its intensity, ranging from minor weakness and dizziness to partial or half-body paralysis. It is believed that 1 among 6 people worldwide will suffer from a stroke in their lifetime, while 5.8 million people die due to it. This makes it a huge cause of concern, as anyone can fall prey to it. The most vulnerable are those who have a history of smoking, heart disease, blood pressure, diabetes, alcohol consumption, drug abuse, lack of exercise, and other such factors. Until the recent past, it was believed that the damage caused to the brain by a stroke is irreversible and permanent, especially if treatment is not provided within 3 hours of stroke occurrence. But due to the advancements in technology and research methods, this theory is changing. Scientists are optimistic that their new discovery will lead to a treatment plan which will exploit the body's ability to heal itself. In fact, researchers suggest that there are certain techniques that could potentially reverse the effects of a stroke in patients weeks or even months after an attack. The technique involves jump-starting the growth of nerve fibers to compensate for brain cells destroyed by the stroke. This is done through the injection of SB623 cells, also known as mesenchymal cells, into the area of the brain surrounding the stroke, while functional and safety results are monitored among the participants. The cells to be injected are derived from adult bone marrow and can express certain nerve growth factors. Moreover, researchers in experiments on rats whose brains had been starved of oxygen to simulate the effects of a stroke found that fewer rats were left paralyzed after the treatment, which activated growth of stem cells in their brains. Professor Ronald McKay and the team of the U.S. National Institute of Neurological Disorders and Stroke examined adult stem cells in the rats' brains and stimulated a receptor known as Notch on the stem cells. The researchers found the Notch receptor caused reactions that produced new brain cells. Therefore, the researchers concluded that Notch is an important tissue and its beneficial effects may involve responses in cells of the vascular, immune, and nervous systems. Stem cell treatments have been making headlines and catching the attention of many doctors and patients alike for countless years now, but it has been unable to measure up to the expectations that have been set for it. Currently, the future prospect for stem cell treatment for stroke seem promising. Now it is important for medical authorities to discern the best methods to treat and reverse the effects of strokes, as it is becoming common and can affect practically anyone. For information on stroke and coping with its complications, sign up at Abudo's online platform. Kickstart a healthy living today.